Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health, well, it's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. In sort of a back-to-back fashion, we took you on out of here on Friday with that theme. We bring you back on Monday with a similar theme. Yes, I do have a number of things on my plate I want to share with you, but anything on your mind is okay with me, as you well know. In the form of a question or a comment, really doesn't matter. The number to get in on that is 412-825-6262. That's 412-825-6262, and I will give that number additionally throughout the hour. Up and coming on our show this Wednesday on the 24th, Dr. Peter DeWitt, medical doctor, talking about something called recall healing. Was looking over some advanced information, captured my eye after reading a number of passages in the publicist stuff that they send me. But I think this is probably captures what Dr. DeWitt's going to talk about Wednesday. He goes, at the root of all illness is shock, stress, and conflict. And Dr. DeWitt's going to be talking about recall healing, heal lifestyle, transform your life, transform your health. Should be an interesting morning we spend with Dr. DeWitt this coming Wednesday. Now on Friday, post-Thanksgiving Day, we won't be doing a live show. We're going to repeat our show with Faye. You know, Faye Houston was with us last Monday, and her book entitled Silent Enemy, Environmental Illness and One Woman's Search for a Cure, I thought was quite telling in that she has literally undergone herself just about every alternative approach to treating illness and disease that I ever heard of. And she was just a grand guest. She's got up-and-coming books. We will bring her back, but I'm going to repeat her show from last Monday on Friday, post-Thanksgiving Day. Now, it won't be too much longer before we turn the page on the month of December. Just looking at it now, we got Brian Foltz coming with us a couple different days in the month of December. Now, he represents Standard Process, a well-known supplement company. We have thought always highly of the company. But of course, we were talking to Jimmy Moresic for all these years when Jimmy was our big rep in this area. Jimmy's moved on to other regions of the country, specifically North Carolina. Tobacco Road. He's somewhere down on Tobacco Road. I did speak with Jimmy. He will come back on our show in the month of January. I'm looking forward to that. Brian Foltz, his substitute or his replacement, filling big shoes, but in talking to Brian, I think he's up to the task. He'll be with us on the 1st of December. Now, some emails have allowed me to communicate with Jim Navarro, as you well know, father of departed and deceased Thomas Navarro, on this issue of cancer therapy and cancer treatments in children, which is taken on a new set of proportions, trying to get a bill introduced in Congress that will allow parents to decide what treatment will be permitted, because as it stands right now, parent, you have absolutely nothing to say about how your child will be treated if cancer happens to be one of those diagnoses that are made. It's just going to be taken out of your hands. Anyway, we're trying to arrange, he suggested to me in an email, to bring both he, meaning Jim Navarro, and Beth Clay on the same show. We're trying to focus in for December 3rd, which is a Friday, and I'll let you know how we come along with that. So, up-and-coming shows as it stands right now, there you have it. Mark them down on your calendar. And if there's any change or any additions, I'll be bringing it up and bring it to you as quickly as I put it up on the list. In the news, let's see. Believe it or not, Barbra Streisand's in the news. Now, she's in the news for a number of things, but she's waiting on a medical issue, which was pretty shocking to me, and she's not happy about it either. She's really upset because she's weighing in through an article I caught that she wrote on heart disease. Now, geez, it just seems so far out of character for having Barbra Streisand weigh in on a topic that is pretty far extreme of what her talent brings to the table. But she makes an interesting point, and it goes something like this. She's a little upset that with women having heart disease as their number one killer, well, that's just the same for men too, isn't it? Well, she makes the case, hey, that's the same for women. It's the number one killer in women, just like it is in men. Yet, all the studies, all the research, everything that is being done currently and on the drawing board for the future has to do with studies done with male patients. There's absolutely no study out there, and I have to agree with Barbara. I never thought I would. I have to agree with Barbara on that fact alone, that the women are getting shortchanged. She says, no more of this. If women are suffering and it's the number one leading cause of death in them, then they deserve their own research for which to be able to make decisions about what should be offered in the treatment of heart disease in women. And as it turns out, it just may be different in women than it is in men. You know what? She may have a point. I don't know. How would you know if the research hasn't been done? So she, as only Barbara can do, I guess, I got it off her chest and wrote about it. I picked up on it. I bring it now to you. Barbra Streisand weighing in on heart disease, saying, no mas, no more of this man stuff when it comes to women's disease, and she has a good point. Another thing in the news, and I'll tell you, you could not be dialing through your television sets this weekend without any news program or related news program not having many minutes spent with respect to the TSA and these scanners and the fact that there's an invasion of privacy going on and all of this. It's just saturated the news cycle for these past 4 or 5 days. And it's not over either. There's going to be much more about this in the up-and-coming future. Now, I'm not going to weigh in on myself on this issue of the security and, boy, does it really do what it says it's going to do. I'm going to focus in on really the one medical issue that doesn't require a political affiliation, which is where I usually always come from, and that is, hey, how much radiation is coming off of those scanners? Now, you know, I've searched high and low, and I mean, I've gone to I can't find it. I can't find any objective information about these scanners and how much of the radiation exposure there really is with each one of those scans. I keep getting these soft cells, and they bother me. I see, well, in my research this weekend, because I started to look for answers to how much radiation comes off of those full body scanners. You know, the one that sort of allows you to be undressed but yet not really undressed. Here's statements I get. Full body scanners are safe. And of course, that always is something that I never take at face value. Then I come across this very low radiation, the same kind of radiation you get in a airplane for 3 minutes at 30,000 feet. Now, that's an interesting way to look at this. So there is radiation, and this analogy of the fact that it's the same radiation you'll get while sitting in an airplane at 30,000 feet in 3 minutes seems to lull you to sleep, thinking, well, that's not much at all. That amount is vastly lower than a single dental X-ray, they went on to say. But I have to share with you something else, which is, speaking of dental x-rays, when that was mentioned, it harkens me back to the day I was discussing this matter, x-rays that is, with my brother-in-law, a dentist. And so we're kicking around the idea about, hey, you need those dental films to do your job, I'm sure, but how much exposure do you think your dental x-rays provoke and cause? For which the answer returned back to me from my brother-in-law. He says to me, well, look, there's no more radiation than you would get taking a stroll in the park on a sunny day. A stroll in the park on a sunny day. Now, these analogies of airplanes at 30,000 feet and stroll in the parks on a sunny day just aren't cutting it for me. And I'm always looking for, when we finally do find out what the heck X-ray exposure there really is to these scanners. And one of these days in the near future, we're going to actually find out. And I'm just going to bet. Now, call me cynical, call me crazy, but I'm just going to bet when we finally find out the X-ray exposure for each one of those, it's going to be far in excess of this 30,000-foot airplane flight for 3 minutes, or a stroll in the park, which is, for one dental x-ray, by the way, a pretty significant matter. And I think as I'm continue to search, and hopefully we'll uncover at some day in the near future. By the way, if any of you do get more concise and factual information about these scanners and how much X-ray exposure you will receive if you get scanned, please let me know. Give me a call. One thing, unfortunately, we won't be able to count on, which we always could count on, John Goffman. Poor John Goffman, no longer with us. John Goffman would be the one source that, if he were alive today, you could count on John to finally bring to you what the actual exposure is when you get one of those scans at the airport. Unfortunately, since he has left us, I don't know when it's going to be and who's going to jump up to be able to fill the shoes of John Goffman, but it's then and only then where this answer is going to be revealed to us. And I got a feeling when it's finally revealed, it's going to have a heck of a lot more X-ray exposure than airplane flights at 30,000 feet, or strolls in the park for an hour, or 30 minutes at the beach, and how many other different ways I've heard this proposed, that this kind of exposure being so safe, actually healthy. I believe they try to connote it's healthy for you. That walk in the park thing, it's healthy for you to get these x-rays, which is utter baloney. Stay tuned. And as soon as I find out more, I'll let you know. All right. That's how we've kicked it off today with some things in the news. Let's do this. Let's take a short break. And when we return, if you got anything on your mind, if you have something to add, if you found out, by the way, a little more about X-ray exposure and how much these scanners are putting out, could you let us know today? I'd really appreciate it. Anything else on your mind is okay with me. When we return, I'm going to be talking about 7 natural cold cures, cold remedies that you probably know a lot about. We'll find out what these agencies who are now to give us the objective information thinks about 7 natural cures for the common cold. Be right back.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in a formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call us now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Monday version of the show. We have a beautiful weekend as it was. Now back and in the chair and ready to roll for another 5 days in a row. Big week this week with Thanksgiving involved, you know. And have opened it up to you today if you want to call in and ask a question or make a comment. Anything on your mind is okay with me. The number to do that, 412-825-6262. That's 412-825-6262. Now, in all the reading I've done in the last week or so, came across this article. It caught my eye because, well, the title alone is catchy. 7 natural cures for the common cold. And as I read more about this particular article, it caught my attention because it talked about objective scientific information to try to back up these claims. And every time I can find science, I always move toward it and like to always share it with you when it's available. And so with respect to 7 natural remedies for common cold, I now bring to you the work of an accumulation of data brought to me in one of the blogs I was on this weekend, starting with echinacea. The specific title of the substance, Echinacea purpura, one of the best known and widely available herbal cold treatments. Now, studies of this particular one are mixed because its effectiveness may vary depending on the preparation. 2 studies funded by the National Center for Complementary and Alternative Medicine found no benefit from echinacea in a juice formulation or in an unrefined combination of root and herb. However, Dr. David Leopold, and he is one that really brought this article to the forefront, so I salute him. He's a medical doctor. He is at the Scripps Center for Integrative Medicine in La Jolla, California. Dr. Leopold says mixing 15 to 20 drops of an echinacea tincture with warm water 4 to 5 times a day has turned out to be the most beneficial in his hands. So it's not real strong, at least in terms of the research out there, but nonetheless it's always been on everybody's fan list, and it's certainly considered one of the 7 most common cold remedies out there in the natural form. The number 2 slot, occupied by golden seal. Now, there may be even, the information has it, may even be less evidence for the efficacy of golden seal, an herb that Bob Martin, a 60-year-old teacher from Placitas, New Mexico, swears by. But there doesn't appear to be much in the way of study to back either Bob or other claims about golden seal, backing up this issue that it can be helpful. Golden seal hasn't been studied as much, but I don't think there's any inherent problem to using it as long as somebody doesn't have an allergy to it, so says Dr. Leopold. The next up, ginseng. Although this Asian herb has taken mainly to boost energy, stamina, and overall health, researchers have begun to examine its efficacy and fighting the common cold. A 2005 study conducted by Canadian researchers found that taking ginseng every day reduced the severity and duration of cold symptoms and appeared to prevent colds as well. Okay, finally, something positive, and it has to do with the ginseng. Now here's one, special place in our heart for it. How about nasal rinsings? Excuse me. Nasal washings. Dr. Hanna, you know, been a guest on our show a couple of times. It's long been popular with the holistic crowd. Daily rinsing is believed to fend off a cold, as she pointed out so aptly in the visits that she's made on this show. It gets rid of sniffles, sore throat. A well-publicized study recently found that children who rinse with saline nasal wash 6 times a day, which I think is a little much to expect, but the study at least used 6 times a day, had an improvement in cold symptoms and fewer recurrences. In the study, 401 children ages 6 to 10 were randomly assigned to standard medication or nasal wash with modified seawater solution, plus standard medication. However, it may be counterproductive to the rinses every day when you're healthy. A 2009 study published in Annals of Allergy, Asthma, and Immunology found that daily rinsing can deplete the nose of protective mucus and actually increase your risk of getting a cold, which is an interesting little slant, is it not? Okay, next substance, one I had not heard of, but one that makes it in the top 7 list, is referred to as Pelargonium pseudoides. I've said it right, folks. Pelargonium pseudoides. I'm not familiar with it, but as it turns out, long popular with the holistic crowd. Where are we here? Okay. Though less well-known than some other herbal cold remedies, extracts derived from this plant have been shown to decrease the symptoms of acute bronchitis and other respiratory conditions. One study published by the Journal of Phytomedicine in 2003 examined 468 adults with acute bronchitis lasting less than 2 days who were given either placebo or an extract of the Pelargonium pseudoides. Those in the latter group were told to take 30 drops 3 times a week. The treated patients saw quicker resolution of symptoms, including pain during cough and fever, and were able to return to work an average of 4.7 days when the placebo group returned to work in 6.3. I hadn't heard of it. If you have any experience with it, let me know. Well, next up, I'm real familiar with this one. Good old vitamin C. Thank you, Linus Pauling. He was the one that brought it to our attention in the 1990s. Won the Nobel for it. Not too much here in the way of new news. I will say it's recommended every day to take 75 milligrams per day for adult women and 90 milligrams a day for adult men. These are paltry and almost embarrassing levels of vitamin C. They go hand in hand with the government's standard daily minimum requirement of 60 milligrams a day, which literally means that if you take 60 milligrams a day, which is the amount of vitamin C found in one orange, you will not get rickets. You won't get any of serious diseases from this, but nonetheless, 75 milligrams a day is a paltry amount compared to what the heck it would be when you really put up against thousands of milligrams a day. Of course, with vitamin C, always be mindful of the 2 Courtney rules, I guess we'll call them, when it comes to vitamin C. The number 1 rule is non-corn derived vitamin C. That's a key component, and when put to that test, there are very few products of vitamin C that will be able to pass it. There's only four companies, or maybe a couple more, that actually make a product with non-corn derived vitamin C. If you go to read the label and there's no mention of any source for the vitamin C, you can assume you've got the corn derived. 99.9% of all vitamin C is made from corn, And because you know that 100% of corn is GMO corn, meaning genetically modified, it really doesn't even have any bang for the buck whatsoever. Biologically, it is a dud. The other item with vitamin C, of course, to be able to take any amounts greater than at least 45,000 milligrams a day. This seems to be that amount which people will reach bowel tolerance on. It's just a natural occurrence from a substance which has very poor absorption. It is water soluble, and as such does not get absorbed well into the gut, into the bloodstream, from the gut into the bloodstream. And that being said, when you try to exceed doses of 45,000 milligrams a day, most of that's going to get lost in the form of loose stool or frank diarrhea. So you can be on the lookout for forms of vitamin C which are fat soluble and which are fully absorbable, and there are a couple brands of those out there in the market. So no surprise that vitamin C makes it on the list. It actually has strong data and strong science to back up the claim that it is one of the 7 treatments to be able to be used. The final one, number 7 here, is zinc. 1996 study found that zinc lozenges reduce the duration of the common cold from 7.6 days to 4.4 days. Other studies have been mixed, but doctors do sometimes recommend that supplement. They say, however, there may be some risk to Zicam cold remedy products. Now, these are homeopathic products, and so I find it difficult to go along with the fact that there may be some risk. In 2006, the manufacturer of the zinc spray paid $12 million to settle 340 lawsuits from consumers who claimed to have lost their sense of smell after using the product. Hey, had to bring that to you. And in June of 2009, the FDA warned consumers to stop using 3 Zicam products due to the risk of a loss of the sense of smell. So I bring that one to you and let you take it for what it's worth. Now, those are what has been labeled the 7 common remedies for the common cold, 7 natural remedies for the common cold, and I'm going to add an 8th. And you will remember this 8th one. It happened to be brought up last week, really, by one of the callers who said, hey, don't you remember when you used to talk about this? And I certainly do and did. But I'm going to put in the number 8 slot really one that I would put in the number 1 slot. And that is the use of a substance called Epicor. You know, about 3 years ago now, we, being myself and Arlene Brecker, first brought Epicor to you. It was not known by anybody here in the Pittsburgh area. We brought this product to Pittsburgh. We were amazed with its ability to actually prevent the common cold. And I thought that was the best news of all with respect to why would anybody take a substance every day if it had no effect, or it would have been like lowered the number of days that you actually were sick. These are difficult things to reason as to why you end up taking product. But Epicor, which is manufactured by a company called Embry Health Sciences, which is a derivative of the Diamond V Company. Diamond V Company is the parent company, and Diamond V is a veterinary feed company. And by virtue of learning a number of years ago that the people who worked with Diamond V on the line, where they actually came in contact with packaging this product that was veterinary feed and then dispensed to many of the cattlemen throughout the entire country, that if they were working on the line, they never did get sick. Now, if they were in the office at the Diamond V Company, yeah, they got sick. They had the same number of sick days that any other company did. But when the actuaries went in and they found out that if they worked on that line at Diamond V, it's then that they, a little light went off. And they said, wow, we need to explore this some more. Some people did, and voila, Diamond V turns out to be a company called Embry. And finally, we get a product called Epicor, I say, and we will talk more about Epicor in upcoming days. Epicor is the number 8. Combine it with symptomatic relief from something called Olbus, and I believe you've got the best of all worlds working for you. There you have it. Not the 7, but the 8 natural cures for the common cold. Do you have a knock on the door? Come on in the store. Hello, and welcome aboard. What's on your mind?
Yes, good morning, Dr. Courtney.
Hi.
Regarding testosterone replacement shots,
Okay.
I had taken some of those, about 3 of them really, and the breast tissue nipples have become sore and tender. So I stopped the shots. I got a prescription for this topical gel, but I've not filled that. Will those symptoms wear off? I mean,
Yeah.
is it something because of the side effects of it, will it wear off?
Yeah. You know what? I'm not necessarily going to be convinced that you should have breast tenderness and nipple tenderness with the administration of testosterone. Yet you know what that was the newest thing on the block for you, and the fact that you could make that relationship, I'm not going to doubt one bit. With respect to the route of administration, as to whether or not you can expect that you won't have those breast symptoms because you're taking from a different route, I don't think that's the way to look at it. It's a circulating blood level, really. It's true that when you take testosterone, the most common form of the injectable testosterone is called testosterone cypionate. Is that the form you took?
I'm not quite sure. They just mix it with vitamin D and testosterone and every 2 weeks. And after the 3rd shot, that's when I noticed now my skin is real itchy as anything, and now I can't sleep at night. I'm up all hours of the night now.
So mixed with vitamin. Boy, this is usually it's testosterone cypionate, which is an oil. The only reason I was trying to get the cypionate, it's an oil form of it, and it's very slowly absorbed. So it will be understandable that you should get one of those shots. Well, I'd say 1 a month, and every 2 weeks, maybe you have been pushing the window a bit. Yet you say you've had your sleep affected by it. You've had breast tenderness develop as a result of it. And when you quit taking this injection, did that resolve? Did the breast tenderness go away? Or
that's only been about since 2 weeks ago, so that's what I'm trying to figure out. I see the doctor Wednesday to find out. That's what I'm just trying to.
Well, let's just say, even though it's difficult for me to conceive how that would happen, anytime something new is introduced into your regime, and so injections of testosterone happen to be what's new for you, and you develop a set of symptoms that heretofore you have not had, then you have got to focus in on what the new thing was on the block, and in your opinion, that was the newest thing, and there wasn't anything else new going on with you, was there?
Well, different medications I'm taking for congestive heart failure or stuff like that.
But you had always been taking those, right?
Yeah, for the last 6 months, yeah.
Yeah, and so you didn't have those symptoms when taking the oral meds. You only got them when getting the injection. Fair enough said?
Well, yeah, the breast tenderness and that, but yeah, correct.
Yeah, okay. So what you need to do, you really, I say, is if you're going to have that kind of response, you stop all testosterone and watch for it to clear, okay? Making sure the symptoms clear. That's the first step. You don't plow on through and get the next injection when you already have a red flag being raised with the previous injection. And then once that resolves, then it's time to be able to test another form to see if you can get the positive benefit without the negative. Because as it stands right now, you're not completely sure whether it's testosterone related, and so you won't ever know unless you quit taking the testosterone injections. So that's step 1.
Yeah, I did those 2 weeks ago, yeah, correct.
Yeah, so once I wouldn't be looking to get another injection of anything just now. You need to wait some time, see that the symptoms completely pass, and once completely alleviated, then move to a different form of testosterone. The topical gel would be certainly a way. There's a standard product called Testum that's sold pharmaceutically. You can also get bioidentically available hormones compounded for you. But then you could see if you could start the administration of testosterone without the provocation of symptoms. And if that would work for you then, all right. But until all these symptoms are alleviated, I wouldn't be taking any more of anything of the new genre, and testosterone was the newest on your list. So you keep taking those other meds of yours, I'm sure there'd be no reason to consider that they are involved here.
Yeah, I know I get swelling in my ankles, feet, calves, stuff like that because of the different medicines.
Yeah, but not the breast.
A question on, you've broached it a few times, never really delved into it. What labs do you use?
For?
Laboratory tests, because I was wondering because of, to expedite a person's visit to your office because of travel distance, have you ever had a person get lab work done first and then so the lab work is there when the person's there for the first visit?
Certainly have done it, and I always like when they do it because it does kill two birds with one stone. We spend so much time on our first visit here trying to get patients to appreciate what our goals and objectives are going to be, that it hasn't been too much of an imposition on them because they appreciated the time that we spent, usually minimum of an hour and a half. Then we go get the labs. The thing that I'll say about the labs is I oftentimes have patients that bring their labs to me, and what they're usually bringing to me are what I'll call the off-the-rack standard labs that most other doctors get routinely, and they're rarely, if ever, helpful because I'm talking to a patient who's not hospitalized. I mean, they're in my office. They're pretty healthy. They're out in the street. They're in with the general population. Their labs are not going to, their off-the-rack labs are not going to be abnormal. So I learned very little from the off-the-rack labs. It is the set of specialty labs that I learned so much. Essentially, they consist of these categories. Number one, the 9 tests, cardiovascular tests, that will not be ordered at all by the conventional medical doctor. Well, I take that back. 1 test is always ordered by the conventional medical community. That's the lipid profile. And that consists of that cholesterol, triglyceride, HDL, and LDL. That goes without saying. But the other 8 tests are never ordered by the conventional medical community. Now, I do order those, and I learned so much about a person's cardiovascular risk factors that you'll have to have those specially ordered by me or you won't get them ordered. It just won't happen out there.
But I mean, have you ever faxed like a blood laboratory, your office faxed like a blood laboratory prior to a visit with you?
That's exactly right. We certainly have. If you would tell us the laboratory that you want to go to, the draw station, literally, around the block from you, we have always done that. We will continue to do it. And that way you could get the very labs that I have ordered. Well, for instance, when Dr. Caminos comes to my office, you know, we have these labs ordered. But it takes a couple weeks to get them back.
Yeah, that's what I'm going to see Wednesday afternoon with Dr. Caminos. So.
Well, hey, if you mention, interesting thing about when you visit Dr. Caminos in Monroeville, you go into the Monroeville office?
Correct.
Okay. The interesting thing about the Monroeville office is when my patients are seen by Dr. Caminos here, we automatically get all the standard Courtney lab work. I'm going to say it that way. The Courtney lab work. If you go to Dr. Caminos out in Monroeville, you'll get the Dr. Caminos lab work, and it'll be the standard off-the-rack labs. It's just the way it's done out there. You have to mention my name. You have to say, I'm one of Dr. Courtney's patients, or I'm going to be seeing Dr. Courtney. Will you get it's called the Courtney panel, okay? And if you say that, then they will get all the labs that I would need to be able to successfully evaluate you. They'll already be done, and if you tell them you're there as one of my patients or soon to be one of mine, they'll automatically send them to me. Fair enough?
Okay.
Yeah.
All right, thank you.
Absolutely.
Bye-bye.
There you go. Yeah, the thing about labs, folks, besides those 9 specific cardiovascular labs, I think it's important to say that the complete thyroid panel will be obtained. There are 6 thyroid tests. Usually the conventional medical community gets 3. Vitamin D levels, oh my goodness gracious, the hot vitamin for 2010, vitamin D is a standard on all the blood work that we get on everybody too, as well as all the studies. So more on that, if you care to talk about it, give me a call. You can call in today, 412-825-6262. Why don't we do this? Why don't we take a short break? In the interim, you just may get the urge to give us a call and weigh in on, well, whatever's on your mind, 412-825-6262. We'll do that for us, 412-825-6262. Going to be back in a moment talking about, well, they just don't get it. You'll see what I mean when we return. Be right back.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on this Monday version of the show. We're opening it up to you, letting you decide. Whatever on your mind is okay with me. 412-825-6262 is the number to get on in here. That's 412-825-6262. We do have a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Yes, ma'am.
Yes, I listened with interest on Friday. The caller from Indiana talking on the...
What was Mr's name? Yeah, I know you're talking about. Sure. The photographer from Indiana.
Yes.
Uh-huh.
Yes. I was wondering, do you have any more information on how you can get in touch with him? Or
Well, he couldn't tell us. His name is, I wrote it down when I was on the air that time, and his name is Mr. McWilliams, and he is a photographer in Indiana. And that's about all I got from it. He didn't really have a website, the best I could tell. I will say this much, I wasn't off the air more than 45 minutes before I contacted this company that he had brought to our attention called Ionic Minerals.
Yes.
Because he was talking about the use of ionic minerals in a situation of atrial fibrillation. That may have what triggered your interest in it.
Yes, it was.
Well, okay, so I contacted the company. I did find this doctor, what the heck was his name, mentioned to me. It was actually the same doctor that he mentioned on the air that's supposed to be getting a hold of me. Well, I thought Friday, but didn't call me back. I promise you this much. I'm pursuing the ionic mineral thing, and we'll have a show in the very near future on this, hopefully being able to bring that entire issue of, well, not just AFib, but other problems besides AFib that have a good basis for treating by giving you these minerals that are so necessary for you in what apparently is their ionic form. And I know nothing more of it than that. I said to those listening on Friday, hey, when you're up in the Indiana area, stop in and get a passport photo to meet Mr. McWilliams because he evidently, according to him, breaks right into a discussion of ionic minerals, which is something, unless you're ready for it, probably catch you off guard. I don't know anything more about him than that, but with there's got to be a McWilliams Photography in Indiana, and hopefully that'll get you channeled into him. Okay?
Okay.
Other than that, you keep listening to the show here because I promise to bring the company on board as soon as they get back in touch with me.
Wonderful. I'll continue to listen.
You keep on listening. Absolutely, ma'am.
Bye now.
Bye now. Yeah, Mr. McWilliams was nice enough to call us back on Friday, and I was listening intently, as I'm sure you were. I promise you that as soon as his company gets back with me, we will bring him on the air. We'll talk about ionic minerals as well as, by the way, a whole host of other products that the company makes. And enough said about that. By the way, the website is tracemineralresearch.com. Tracemineralresearch.com. Another knock on the door. Come on the store. Hello, and welcome aboard. What's on your mind?
Oh, good morning, Dr. Courtney.
Hi.
Yeah, I'd like to know about that Epicor. Could you repeat what you said at the beginning of the program? I didn't get all of that. And I'd like to know about the Epicor thing.
Yeah, the Epicor thing. Epicor it is the name of a product that is manufactured by, put together, distributed by a company called Embry Health Sciences. Embry Health Sciences is a division of Diamond V, a veterinary feed company that discovered a number of years ago that the very stuff they were putting in veterinary feed was allowed for one jammed up product in the veterinary world. Everybody who had animals and livestock would want Diamond V feed because they knew their animals stayed healthier. And then when they found out that people who worked at Diamond V didn't get sick if they worked on the line, they just didn't take any sick days. That was the thing that sort of pulled the curtain back and revealed a very interesting concept, which is there's something in that product that is protective of disease, viruses, and bacteria. That has led to the formulation and selling of this thing called Epicor. We meaning myself and Arlene Brecker, brought this product to your attention about 3 years ago. And a caller called up last week and mentioned it, said, hey, what about Epicor? Don't you talk about it anymore? And I said, I absolutely do. I just hadn't mentioned it in the air. And so mentioning it today as I did, I thank him for bringing it to my attention. And I call it the best way of all that I know to prevent the common cold is through the use of Epicor prophylactically, taking one a day, and you won't get a cold. How about that?
That's good. I just wondered, what about cancer? Did they put any studies as to how it works on the cancer realm?
Well, the only way they make no claims with respect to cancer, but I can say this: the basis by which Epicor is supposedly works is by increasing the NK cell population of your own immune system. Well, if there ever is a link between a physiological phenomenon and protection against not just colds, but all diseases, and in particular cancers, it's increasing your NK cell population. So they don't make the claim that it's going to prevent cancer, but I will say anything that increases your NK cell population will and can. Okay?
Okay, thank you.
Absolutely. Epicor, folks, we're having somebody from the company called up. I was calling everybody on Friday. Called Epicor, and we're trying to run down one of the newer gurus that work for the company. We can bring them on the show. So I promised you I would, and I will. Knocks on the door continue. Come on the store. Hello, and welcome aboard. What's on your mind?
Hi, doctor.
Hi.
I have pneumonia.
All right, ma'am.
And I was wondering if the hyperbaric oxygen pressure in Bridgeville would be of assistance once I'm out of the hospital.
Well, let's just say that right now, having pneumonia as you do, you're in the hospital. You're calling from your hospital bed?
Yes.
My good, what hospital are you in?
St. Clair.
St. Clair. Okay. You are right where you need to be for right now. I'm sure you're getting intravenous antibiotics.
Yes.
And as much as I know that you probably would like to be able to avoid them. You're in a situation where you really need them, okay? So don't worry so much right now about what you're going to do when you finally get discharged. As to whether or not hyperbaric oxygen will be helpful to you, especially if you have difficulty in breathing, you won't find it's necessarily an antimicrobial procedure, because it is not meant to kill bugs. That isn't what hyperbaric oxygen does. But there are so many things that you can be doing. Geez, maybe when you get out, could you come in and see us so we could talk about a myriad of things that will help prevent any pneumonias in the future. Let's get you over this one. Hyperbaric oxygen will not help to kill any bugs. If you have shortness of breath and difficulty breathing, it can help doing that. So, to that extent, yes, it can. But then you need to be on a regime once you get out of the hospital that helps prevent any further pneumonias into the future. And they should be safe, non-toxic, and don't have to be pharmaceutical kinds of drugs in order to do that. In fact, we would encourage you to be not using them at all. That is at a different time, however. Right now, please take what the nurses are giving you in an IV bag as they come around and refill it. And hopefully you'll be out and about soon. Give us a call when you're on the outside, and we'll talk some more, all right?
Thanks, Doctor.
You're welcome.
Bye.
There you have it. Bye. By the way, I with that caller, I can never forget. I was driving down the road one time, and one of the commentators, one of the hosts of a show on KHB, I won't get into any names, received such a call as this, where there was a poor guy who was calling from his hospital bed, and he said to that host, "Well, look, I'm here right now," and the host asked him, "Well, how you doing? How you getting along?" And I don't think the fellow was doing too well. And they saying to the host, "Well, they're doing this to me, and they're doing that to me, and nothing's working, nothing's helping." And at one point, the host just said, "Look, what you need to do," I almost wrecked the car whenever he said this. He said, "What you need to do is rip that IV out and leave that hospital and come directly to my office." I swear to God he said it. I almost wrecked, and ever since then, I've lost a lot of respect for that particular individual, and we'll let it go at that. Next up in the store, come on in the store. Hello, welcome aboard. What's on your mind? Hello.
Good morning, Dr. Courtney.
Go right ahead.
Hi, I wanted to contribute to your list for the cold.
Oh, you got a number 9.
Yeah.
Go.
Hopefully, I guess.
Go right ahead.
Glucan?
What'd you say?
Beta-glucan?
Oh, beta-glucan for macrophage production, right?
Yeah.
Yeah.
I guess it's something to do with the T cells and the killer cells, and it's sort of along the... This was, I guess, popular before the one that you were just speaking of.
No, you're so right about that.
It's a different type of glucan, but this one's just 3,6-beta-glucan, and I kind of swear by it. I don't know.
Hey, it produces macrophages, which are well known to be defenders of infectious agents. So you're so right to bring the number 9 to the table. This is the biggie from Don Carell. I remember Don Carell. I know you do.
Yeah.
Dr. Carell would be the first one to... This would be number 1 on his list. Thanks for bringing it to our attention. By the way, I'm always interested in what you bring. Any others besides the number 9? You got a number 10?
Not offhand, but I did have a question about the first 3.
Uh-huh.
Echinacea, golden seal, and the Iberian ginseng, or any
Yeah.
type of ginseng. Now, I know, generally speaking, those are very good for the immune system and colds, but I remember reading in the past where they kind of tell you to hesitate if you're a type 1 diabetic to take any of those 3, golden seal, echinacea, and
Ginseng.
the ginseng, just because I guess it can stimulate the immune system of anybody, I guess, has type 1, which is thought to be like autoimmune. But is there any concern for that?
No, I really, as much as you say you've heard that that's a caution, I'm not familiar with any of those concerns, to the extent that it can stimulate your immune system to help protect you with infectious agents. I don't see the downfall in whether you're diabetic or not with respect to your immune system.
But I'm going back to the late 80s, early 90s. I remember them saying that it could have changed.
Oh, boy.
At the time.
Yeah, that's another time warp. The 1980s, my God, when doctors were asked to comment on these back then, we're talking about archaic times, really, compared to where we are now. I know of no such contraindication for the use of any of those three now.
Because I know the chiropractor I was going to at the time had said if you're on it, go like 2 weeks on, 1 week off. 2 weeks on, 1 week, just so that it doesn't, I guess, accumulate.
Well, if you're talking about the root for the way most people get type 1 diabetes, it usually is immune related. So I think I understand where you're coming from, trying to explain that. But by turning on your immune system's ability to help you against microbes, I don't see.
I'm sorry. It's just specifically to those three, not in generally speaking anything that turns the immune system on. Just those types of herbs, because of the nature of the herbs, like stimulants.
Well, anybody out there want to add to that? I'm unfamiliar with those indications or cautions.
Yeah.
But I'm sure that at least when you heard them, at the time they were valid, and the main concerns that had some validity to them. It's just I'm not familiar with those at this time.
I thought of number 10, vitamin D, but maybe you mentioned that.
I didn't mention vitamin D, but boy, the hot vitamin for 2010, I'll make it number 10. We got a top 10 list now. Thanks for making it so.
Thanks, Doctor.
Absolutely. Always interested in listening to that particular. Always listen to you, too. Anything on your mind is always okay when we ask you to give us a call at 412-825-6262. We're coming up on the gun lap here. We're coming around the stretch. We're ready to get on out of here. In fact, as a matter of fact, I hear the bongos in the background signaling just that. I promise on Wednesday, I'm going to bring to right off the chute, going to talk about a new use of the term, which we've heard a lot of recently, called "they just don't get it." Now, that one's been applied to a lot of politicians recently. I'm going to apply it in a different way. We'll see you on Wednesday when the doctor's going to be here talking about, well, Dr. Peter DeWitt's going to be with us, talking about Heal Thyself, transform your life, transform your health. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more